Just 2 days ago, the number of coronavirus cases recorded worldwide was estimated to be 119,000, with more than 4,000 deaths confirmed. By Wednesday, 11 March, the World Health Organization determined that the fast-spreading coronavirus outbreak is now a pandemic and one that the worst is yet to come. What are countries doing to protect citizens and travelers against the spread of the COVID-19? Our nations of the world and global markets combating its spread.
Meanwhile, across Iran, which is one of the worst hotspots outside China for the virus, people along with governmental organizations help sanitize and disinfect public roads, streets and other places.
The last pandemic declared by the World Health Organization was the influenza outbreak in 2009. At the time, the decision was criticized by some countries which felt that it caused unnecessary panic. It also led to many nations wasting money on vaccines for a strain of flu that proved to be mild and relatively easy to contain. That may explain the delay in the World Health Organization declaring the COVID-19 a pandemic. But after careful consideration of its impact across the world, the Director General of the World Health Organization at a COVID-19 media briefing declared the virus a global pandemic.
We're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction. We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
But what does this mean? What are the implications, especially to Nigeria currently? Pandemic is the term used by disease experts when epidemics are growing in multiple countries and continents at the same time. This is different from an epidemic, which is an outbreak that, even though out of control, is still limited to just one country or location. So quite simply put, the coronavirus has been labeled a pandemic because of the numbers. It is a widespread human-to-human transmission. It is in several countries and continents, and it affects a large number of people. According to the World Health Organization, there is a recorded over 4,500 deaths and over 1,200 confirmed infections in over 120 countries. Other examples of pandemics include HIV, which has killed over 30 million people since 1980, and the 1918 Spanish flu, which killed between 20 to 15 million people. Some of the most deadly pandemics in history were the Black Death, which killed up to 200 million people in the Middle Ages, and smallpox, which killed about 300 million people in the 20th century. As seen in the past pandemics, there has been a lot of scare around the spread of the coronavirus. Millions of people are under citywide lockdowns in China and recently Italy. Global markets are crashing and oil prices are falling because of reduced oil demand. There is currently a lower global economic activity because of the virus outbreak and the current oil war between Saudi Arabia and Russia. Oil price is at $30 per barrel, hitting Nigeria hard because of our mono economy, which is dependent majorly on oil. The Nigerian government has proposed a cut in the 2020 budget. Though the size of the budget cut is still unclear, the Minister of Finance, Zainab Ahmed, speaking after a meeting with the President, said a committee which includes the Minister of State for Petroleum Resources, the Group Managing Director of the NNPC, and the Central Bank Governor and herself would determine the size of the budget cut in the coming days. Nigeria is barely able to curtail the spread of the recent Lassa fever outbreak, which so far, according to the World Health Organization, has seen the country managing about 472 cases with 70 deaths. 26 out of 36 states have been affected in just 1 month. There have also been 15 confirmed cases of Lassa fever among health workers, with 1 death. This endemic mirrors the current situation with the coronavirus, which has just been declared a pandemic. A fast spread within a short period that sees health workers at the front line of combating the virus also infected. As the world faces confusion on ways to manage the spread of this virus, it is obvious that as a nation, we must wake up from this current inaction and do everything to curtail the spread while hoping for a vaccine in the months ahead. The major preventive methods still includes good personal hygiene, washing of hands regularly, avoiding hands touching your face, and distancing yourself from people who are sick. Also seek medical attention if you have symptoms like coughing, difficulty breathing, and fever. We must all continue to hope and hold on to dire words of encouragement like those shared by the Director General of the World Health Organization at the March 9th media briefing.
The rule of the game is never give up. I'll repeat that. The rule of the game is never give up. Let hope be the antidote to fear. Let solidarity be the antidote to blame. Let our shared humanity be the antidote to our shared threat.